I started noticing symptoms probably when I was around, I'd like to say, 10 years old, perhaps. It was just, my stomach was never in a good place, and I was always worried to do stuff because I was like, I don't know how I'm going to feel during it. Sometimes it can leave you bedridden, sometimes you're completely fine and life's fine, but it's the times that you're not okay that really are a drag.
So the timing is important because all of a sudden the patient has symptoms of frequent bowel movements, diarrhea, urgency, nighttime bowel movement, more fatigue, affects the quality of life. And you want to make sure that you can treat those patients promptly with either adjusting the medication, or even starting them on another medication, or see if the medication is actually working for them.
Anytime that exams kind of come into my life, you start to feel stress, whether you realize it or not, and that can really have an impact on your whole digestion.
An IBD nurse is a registered nurse, and it could be either a nurse practitioner or a registered practical nurse. It can be a registered nurse with information about the disease, the course of the disease, how the disease is managed, and understanding the patient's needs. So the role as a nurse is to look at what's happening to them from a disease perspective, but also how's life treating them? What's stress doing for them? How much stress do they have? Are they going to school? Are they going to, do they have anything special to do or anything that's causing stress? How's the relationship with the family? How's the relationship with a partner? All of those things are very important. IBD is very intimate disease.
I was going through exams in high school. I think it was grade 10. The day after I was in the hospital, I was admitted to McMaster, and I spent 10 days in there.
So it's important to see a patient with an illness or a chronic disease as a person rather than a patient with a disease. That person has life ambition, lifetime goals, aspirations. Knowing what their aspirations are, then you can sort of adjust treatment accordingly.
So once I got everything under control, I went to McMaster, where I completed a Bachelor of Commerce in Finance. No matter how large things were piling up, it was always good to know that someone was a phone call away or an email away that could help me out. Without my IBD nurse, there'd be a lot of times at those most difficult parts of my life where I didn't have that go-to person, that linkage that would help me out. And it's always good to have somebody on your side that knows how you're doing and knows your case and can make sure that you get the best outcome.